Now, 31 people are still in hospital receiving care, and this is following last week's fire that claimed the lives of 77 people in the Johannesburg CBD. So far, 10 families have identified their loved ones from the 12 identifiable bodies, and 7 have already been released. The Gauteng Health Department moved the victims to the Diepkloof mortuary. Motalatale Modiba is the spokesperson, and he joins us this morning for an update. A very good morning to you, sir. Certainly a very tragic turn of events that we've seen transpiring last week. Families still trying to identify their loved ones, several of the bodies charred beyond recognition. But can you give us an update as to how the processes are unfolding thus far?
Well, thank you, Tammy. As you rightly said, we still have about 31 patients that are still in hospital. Of the 88 that we've seen through our various health facilities, we're remaining with the 31. In terms of the other processes, yesterday we gave an update to indicate that pathologists on Sunday completed the postmortems for the 74 bodies. These are the 74 bodies of people who died on the scene. And also they have also completed postmortems for the additional 3 bodies of the people that would have passed on while in hospital. So all in all, it will be 77 bodies where postmortems have already been completed. And also the police were able to do DNA sampling for the 62 unrecognizable bodies. You recall that we had some bodies that went beyond recognition, and out of all the bodies, the 74 bodies that were found on scene, about 12 of them were recognizable, and of those 12 that are recognizable, already 10 families have come forth and they've positively ID'd their loved ones. And of those, 7 families have already, because they complied with all the processes, they've already actually taken the mortal remains of their loved ones to proceed with burial.
I'm not quite sure how much of the details you are able to share with us, but I'm quite interested in the process of identifying a body. What is essential that will allow the Department of Health, for example, to be able to identify a body? As far as DNA is concerned, is it teeth? What actually do you need? What remnants of the human body are actually needed in order to get a clear link as to who they are?
Look, the situation differs. Nails, teeth, any tissue that is salvageable from the body that the pathologist can be able to make use of. You'd recall that in terms of the current process, the DNA samples from the 62 unidentifiable bodies is not done by ourselves as Gauteng Health. It's done by the police, because the police process, because they have to take those DNAs and obviously allocate unique numbers and so forth. They are also furthermore beyond the DNA, and this is the reason why we are making the call for families to present themselves, is that beyond the DNA, they also do what is called an antemortem swabbing. This is where family members, and this is what we're talking about, those family members, as in siblings, children, or parents, have to come forth so that sampling or swabbing can be taken from them. And once that is done, what then will happen is that there will be cross-referencing in terms of the DNA samples that were taken from the bodies, and then that will be cross-referenced against the DNA swabbings that were taken from the family members, so that we can then be able to match. Because in instances where there are no recognizable marks, sometimes people have tattoos and other unique identifier on their bodies. Once the bodies have been cleaned and so forth, and still there are no such, you have to go through that particular process so that you can then be certain that the body that you are releasing the right body to the correct family, because the last thing that we want is to obviously put families through secondary trauma because you have buried the wrong one. And I know the question that we always get is, what will happen when you've done all of this and you still cannot locate family members for certain bodies, what will happen with those bodies? Well, there's a particular prescribed period of 30 days, but obviously these are unique circumstances. The process might go beyond those that allowable period, but once that period has lapsed, the department is able to then notify the local authority. In this instance, it will be the city of Johannesburg, to say, we have so many bodies that have not been claimed beyond the allowable period, and therefore the city, because the purpose burials, those are processes that the cities will run. The city will then obviously go through their own council process for them to be able to then process the purpose burial. But we are not yet there at this stage. At this stage, we are still urging family members who suspect that their loved ones might have been those that demised at the Johannesburg inner city fire building, so that they can then be able to come through at the Diepkloof forensic pathology services. This will then allow the police to conclude the process of taking antemortem samplings from the families. So far, we know that 69 families have presented at the facility to come and report that their loved ones, they suspect that were in the building, are nowhere to be found. And from those 69 visits, we were able to compile a line list of about 69 names. Now, sometimes we find that different family members would come at different times, and therefore we have to register them individually when they come. But what is common is the names, where you find that one name is claimed twice or more than once by different family members, because sometimes because family members are coming from different places, at times they will come at different times. But at least at the facility, there is what we call a line list that is developed, where we're able to record each and every person who comes and makes a particular claim, so that when the time of cross-referencing comes, we're able to then double-check that.